Hi, I'm Rachel Ballard, your occupational therapist. How are you doing today?
Good.
Okay, so you're in because your shoulder has been hurting?
Yes.
Where exactly has it been?
Right back here.
Okay.
Especially if I try to throw overhanded.
Okay.
I can feel that all in here.
Okay. So we're going to do some shoulder exams just to see if we can see where the problem is coming from.
Okay.
Okay. So first we just look at it to see if there's any redness or swelling or muscle atrophy. So first we'll look at your sternum and down your clavicle. And I don't see any redness or swelling, so and we compare them to the other shoulder. So we'll look at your acromioclavicular joint. Compare it. There actually might be a little swelling. And then we'll look at your humerus. It looks pretty good. And your dominant arm is usually held a little lower, and this is your dominant.
Yes, it is.
Okay. And then down your spine. So there might be slight swelling on this side, anteriorly. So we can continue with that. Okay, and then the next part is I'm going to palpate and feel, and you tell me if there's any tenderness or pain.
Okay.
Okay, so we'll start at your sternum and your sternoclavicular joint. Okay, is there pain?
Not really.
Not really. Okay. Then down your clavicle.
Yes.
And then a coracoid process of your scapula is actually right about here. So tell me if there's any pain. Right there.
That's a little tender.
Tender?
Mm-hmm.
Tender. Okay. And then your acromioclavicular joint. And your acromion. And the front of your femoral joint. Is there any tenderness or pain?
No.
Okay. Here. Your humerus.
No.
It's really okay. And down the spine of your scapula. And then down the medial border. No pain?
No, not really.
So let me continue to palpate some of your joints, and there's actually a bursa underneath here. So if you can extend your arm back like that, okay, and I'm going to see, you tell me if there's pain.
A little.
A little?
There's
right there?
More. Mm-hmm.
Okay, so that is about where the bursa is. Okay, you can put your arm down. And now if you'll bend your elbow like that, and then externally rotate, which means do this. Exactly. Okay. And this is your bicipital groove. Do you feel tenderness?
Mm-hmm.
There's normally going to be some tenderness in there, but it shouldn't be too painful. Okay, and then you can place it down. And then now I'm going to show the muscles on your scapula, so if you can face the wall for me. Okay. Make sure. Okay. So, we have the spine of your scapula, which is right here. And then we have supraspinatus. Now you tell me if there's any pain. Okay. Then we have infraspinatus. And teres minor. Okay. And then teres major is here. You feel pain?
Just a little tender.
Just a little tenderness. Okay. Okay, and then we go up your trap. Trapezius. So do you feel any tenderness up in here?
No.
And then on your neck? Do you feel tenderness?
Yes, but I think it's something totally different.
Okay, so it's not pain?
Yeah.
Oh, it is pain?
Yes.
Oh. Okay. And then, if you'll turn back towards the camera, we're going to, in your armpit, so if you can raise your arm like this, and then I'm going to feel this. Tell me if there's tenderness. Here. In the front part?
No.
No. And on the back?
A little.
Right there?
Just a little, yes.
Okay.
Maybe farther on the inside when you put
On
the
the
inside some towards my body. A little more.
Okay.
Yes, right there.
Right there. Okay. Okay, thank you. Okay, now I'm going to ask you to do a couple of movements. So if you'll just face towards the camera, and I'll tell you what to do. So first, this is called abduction, and you move both of your arms up, and all the way up, all the way as high as you can go. Tell me if there's pain. Keep going all the way.
There is some pain.
All the way to touchdown. Touchdown.
So
is there pain? Where was the pain at?
About right where my arms are face down. Right about in here.
Right there?
Mm-hmm.
Okay, and then continue all the way. Okay, and then now watch me and drop your hands behind your head. Tell me if there's pain. Is there pain?
No.
No. Okay, and then now moving back up. And then slowly, palms facing down. Bring your arms down, back down to your side. Okay, and now always tell me if there's pain in these movements. Now bring your left hand and like this across your chest to your other elbow. Is there pain?
Yes, some.
Okay. Okay, and then do the other side. Same thing. Was there pain when you did that?
No.
No. Okay, where was your pain when you did this?
It was in the front.
It was in the front.
Mm-hmm.
Okay. Okay, then can you face the wall? And then watch my movement. This is called flexion, so you're gonna slowly bring your arms all the way up, forward, and tell me if there's any pain.
There is right there.
Right there?
Mm-hmm.
Okay. Okay, and now bring it back down slowly and continue past your body, so to go behind you. Tell me if there's pain.
There's just a little, but not here, but right where we were a minute ago.
Okay. Okay. And you can relax. Now you're going to face the wall for me. Okay, and this is called internal rotation and adduction. So you're going to bring your left hand and you're going to bring it in the middle of your back, as if you're getting your bra. Now you tell me if there's pain when you do that. So okay, that's your, okay, is there pain?
There was when I lifted it up. Right back
when you lifted it up? At what moment?
But now it's not.
Now there's no pain. Right there there's pain?
Right there.
Right there there's pain?
But then if I go and still, it's okay.
Then it's okay?
Mm-hmm.
Okay.
But getting it there.
Okay. Can you do the other arm? You can bring the other arm. Yeah, that one. Okay. Did that one have any pain?
No.
Okay, you can relax. Okay, now you're going to do a push-up on the wall. And so you're just going to stand like this and then push down and just go slowly. I'm going to watch your back.
That hurts.
Ooh, where does it hurt?
On the front.
On the front?
Left shoulder.
Okay, you don't have to do anymore. Okay, relax. And then, if you can face the front again, then you're going to bend your elbows like this. And this is called external rotation, and you're going to externally rotate until it hurts. Does it hurt?
A little.
Okay, and then internally rotate.
Mm-hmm. No.
Yeah. So where did it hurt when you did this?
Right here.
Okay, where at? Okay. Okay.
Ow, now that I pressed on it,
Oh.
it really hurts.
Don't press on it. Okay. Okay, now we're going to do some passive range of motion, and your movements were smooth and complete. So this doesn't really show us much more information, but we're going to do it for the sake of the video. And first, I'm going to place my hand on your acromioclavicular joint, and then we're going to abduct your arms slightly. And then, can you bend your elbow? Okay. And then if you can turn it out like that. You can put your elbow down. Does that hurt?
Yeah.
Okay, now put it towards your stomach.
Yeah.
Okay, you can relax. Okay, and now we're going to move on to more specific tests. Now, Mom, we're going to do some tests for impingement, which is there's many tendons that go through the space under the acromion, and so they can become impinged, which can cause some pain.
Okay.
So the first test that we will do is I'm going to hold this down, your acromion down, and then you just relax and tell me if there's pain.
Yeah. Well, it just feels like my muscles pulling.
Okay. Tell me if there's pain.
Oh, it feels like it's going to pop. Yes.
Feels like it's going to pop?
Yeah.
Okay. Yeah, that's good to know. You felt like it was going to pop out?
Yeah, I felt like you were going to pop it. Yeah, it was going to pop.
Okay, that's good to know. All right. And then we're going to go forward, and you just relax. And then you relax. Okay, now can you turn your hand in like that? Yeah. Does that hurt?
Not really.
Okay, you can relax. Relax your arms. Okay, one more test for impingement.
Okay.
And you're going to hold your acromion again, and we're going to flex your arm to here, and then can you bend your elbow? Bend it, and then put it right here. There we go. Okay, I'm going to turn it in, and you tell me if there's pain. Okay, so
yeah, there's a little back
a
here.
little.
Yes.
Now there's a lot of pain.
It's back here.
Okay.
Well, no, it's stopping now.
See how you're compensating with your
Oh, I am.
forward?
Am I?
So let me hold you down. Okay.
Okay.
So put it forward. Okay, and now let me turn
Put my arm down.
You're very much calm. Does it hurt? Okay, let's not stress it.
No, I mean, it's not hurting too bad. I just can't. It won't do that.
Okay. Now we're going to test the muscles of the rotator cuff.
Okay.
The first muscle, which is up here. The first muscle is called supraspinatus.
Okay.
And it's just above the spine of the scapula. So it's right here. You feel that?
Mm-hmm.
Okay. So first, I'm going to ask you to stand with your elbows flexed, and then your arms just slightly out like this. Okay? And I'm going to put pressure, and you resist. And tell me if there's pain. Okay. And resist as well.
A little, but not too bad.
Not too bad. Okay, you can relax. Now we're doing the empty can test. So if you can, you're going to flex your shoulder to about 90 degrees, which is this. You're going to hold this can, and then internally rotate it to face the can down. Does that hurt? And if you can do it the same with your other arm.
I mean, I can feel it some, yes.
Put your other arm up and anything. No, keep this arm in with the can, because that's your arm that's affected. So hold the can in this arm.
Oh, okay.
And then
do the same
turn
thing.
the can, empty it out, empty it. Okay, and I'm going to put pressure, and you resist.
Oh, that hurts.
Does it pain? Okay, show me where it was.
It was about in here.
Okay.
It was weird. It was in two places, but I really felt it right
in here.
Mm-hmm.
Okay, you can relax. Now we're testing infraspinatus and teres minor. I know those don't make sense, but those are the muscles right under the spine of your scapula.
Okay.
And they work to do this with your arms. So externally rotate your shoulder joint. So with both of your arms, if you can flex your elbows and then externally rotate them like this. And I'm going to put pressure and you resist and tell me if there's pain.
Yes!
Okay, relax. Where was the pain? Where is the pain?
Right there.
Okay, now we're going to test the subscapularis muscle, which is a muscle actually underneath your scapula.
Okay.
And we're going to do the resisted isometric internal range of motion test. So you're going to flex your elbows to 90 degrees, and then you just internally rotate them like this. So keep your elbows in, and just bring your forearms across your stomach. There you go. And then I'm going to pull on them, and you're going to hold them there. Okay, so I'm going to stand behind you. Okay, tell me if there's pain. Is there pain?
Not a lot.
Okay, you can relax. Now, if you can face towards the wall, we're going to do the scapula lift-off test. And you're going to bring your arm back like you were doing your bra. Hold it off.
Okay, right now?
Yes, ma'am. So can you pull it off? Okay, now I'm going to push it and you hold it and tell me if there's pain.
It's already hurting.
It's already hurting? Then just relax.
I mean, it's not bad.
Not bad.
But I can, yeah.
Okay, relax and show me. You can turn around and show me the pain. Same place. Okay. Okay. Now we're testing the biceps tendon, and the first test we're going to do is the Jurgensen's test.
Okay. So
remember the bicipital groove that we had to find earlier? So you'll externally rotate so I can find your bicipital groove. And this, is it tender right there? A little. Okay, and then feel face it. Just a little. It should be a little tender.
Yeah, where your thumb is, yes.
Okay. So can you put your palm up? Now I'm going to try to turn your palm down and you resist me. Is there pain?
Just when you press.
When I press on your bicep? Is it like super pain
No.
or is it just uncomfortable?
No, just uncomfortable.
Okay. Again, to test the biceps tendon, we're going to do speeds test. So you'll put both of your arms out like this. And I'm going to put pressure on them and you resist. And tell me if there's pain.
A little.
A little, but not really.
No, not a lot.
Okay, you can relax. Now we're going to do further testing on the acromioclavicular joint. And the first test we will do is called the scarf test. So it's kind of like that motion that I had to do earlier.
Okay.
Like this. So you're going to bring it across your chest, but this time we're going to go up behind and I'm going to push it. So you tell me if it hurts. So bring it kind of like you're stretching your tricep. So I'm going to push it back.
That hurts.
It does?
mean, it's not ow, but it hurts. Okay.
Okay, show me the pain, where it was.
Well, it's up here and then a little back here, but there's more up here that time.
Okay, you can relax. Flex your shoulder all the way up above your head. And this is kind of like a tricep. You know when you're stretching your triceps? So then just go back, and I'm going to stretch it, and you tell me if it hurts. Let go of this arm. There we go. Does that hurt?
No, not the joint. It just hurt my muscle because
okay.
muscle needs to
because you stretched. Okay. Now we are going to do some glenohumeral joint testing, which is where this is like a ball, the end of your humerus, and it fits into a socket. So that's your glenohumeral joint.
Okay.
And the first thing we need to do is test posterior, which is the back, stability, and anterior stability. So all I'm going to do is grab your humerus just above the acromion, and I'm going to move it posterior to the back, like this. Does that hurt?
Where your finger
Okay, where my finger is. And then to the front. Okay. So, will you relax?
I'm trying.
It hurts, so I want to touch you. Does it hurt right here? Just over here. It's very tender right there. Okay. I'm going to pull down. This is called sulcus sign. And this test is inferior instability, which is just deeper. And I'm going to pull down on your humeral head. And I'm going to grab it and pull it down. So there's no sulcus that appears. So one more test on the muscles is called the apprehension test.
Okay.
And we are going to abduct your arm. And I'm going to hold this in place. And then if you'll flex your elbow. Thank you. And now I'm going to externally rotate it. And you tell me if there's pain. Is there pain?
I think it's just my muscle pain.
Where is it hurting at? Oh, back here.
But when you let your hand loose, it hurt up here.
When I let it loose. So if I hold it down, it's okay. But if I look,
I feel it. Yeah, I feel it right in here.
You
can twisting. It's like if my muscles been twisted.
Oh, okay. Now we are going to do some neurovascular testing, and first we'll start with myotones. I know that doesn't mean much, but for the video.
Okay.
So first we're testing myotones C5 through T1.
Okay.
And the first muscle that we'll test are the deltoids. And so you have to do this with both of your arms. This is C5. And I'm going to push down and you resist. Okay. The pain?
Yes.
Where's the pain at?
Just
very
a little.
slow. Okay. Okay, you can.
I mean, it wasn't really bad. It just, yeah.
Okay. Still sore. Okay, and then we're going to do C6, which is biceps and wrist extension. So you're just going to do this, like that. So biceps, resist, and then your wrist extension, resist. Okay, good. And then we're going to do C7, which is triceps and wrist flexion. So you just stick your arm behind your back like this. Okay, that's good. And then C8 is the flexion right here. So you do this. Put your arm up here. And just flex these fingers. Okay, good. And then T1 is finger abduction. So just switch your finger. Okay. Okay, so it seems like now we're going to test the dermatomes. So if you'll just stick your arm out like this, like so. And I'm just going to demonstrate it for the camera. So let's scoot. If you can scoot to your right. We're done with the shoulder testing. So if you can spread your fingers out. Okay. And we'll start with C5, which is the lateral aspect of the arm. And then we'll go with C6, which is the tip of the thumb. Do you have sensation? Mm-hmm. And then C7, which is the tip of the long finger. You feel? Then
my hand started tingling. It's been out there so long.
And then C8, the tip of the baby finger. And then T1 is the medial aspect of the upper arm. So,
I feel it.
Okay, and you can lower and relax. Thank you so much for participating in my shoulder exam.